Hello, everyone, and welcome to the MJH Life Sciences Studios for the very first episode of the Primary Care Lens, brought to you by Patient Care Online. I'm Patrick Campbell, Editorial Director of Patient Care Online, and I'm so excited to kick off this new series with you all. This podcast is built around the idea that primary care sits at the center of medicine. It's where most patients' journeys begin, where complexity often lives, and where so many of the realities of our healthcare system become most visible. And I can't think of a better person to launch this than our host, Dr. Jubril Oyeyemi, who not only practices in primary care, but also runs a free clinic in Cherry Hill, New Jersey, serving patients who might otherwise fall through the cracks. Dr. Jubril, thank you for being here and for leading this conversation.
Thank you, Pat.
So first, I just wanted to start out a little bit. At MGH, we talk a lot about our driving mission and the why behind what we do. I know you have a pretty interesting why. So before we get into the landscape of primary care today, why don't you tell the audience a little bit about what motivates you and how you got to where you are?
So thank you so much for that opportunity. My journey actually starts thousands of miles away from here. I was born and raised in Nigeria, and one of the startling events for me really early on was as a preteen getting to witness my 4-year-old neighbor, Esther, pass away just overnight. And this was such a shocking thing to the system. Esther was loved by all of us. She was so affable. And to wake up one morning after a seemingly unremarkable night prior to find out that Esther had passed away. And the reason she passed away was even more shocking. She passed away because she had a fever, and there was really no medical help, not for the next hour. And really, as I think about it now as a practicing doc, that could have been prevented by just with Tylenol. And that experience would leave such a mark on me. Still remember the powerlessness I felt as a result of it. And that moment got me going, you know what, I want to do medicine. I want to pursue medicine because I want to make sure that Esthers don't happen in the world, right? And so fast forward, finished high school, moved to the U.S., interestingly, because it was harder to get into medical school in Nigeria, actually. So moved to the U.S., went through college, pre-med, went to med school, and right out of after med school, went straight into residency. So I did one of those like straight, all straight through, all 10 years. And right out of training, I joined a local practice in South Jersey as a hospital doctor, as a hospitalist. And so, I remember it, week in, week out, as a hospitalist, you're admitting patients from the ER. Once my ER colleagues decided that you needed to be admitted, they called the hospitalist to do the admission and to attend to you over the 3 to 5 days you're there in the hospital. And so week in, week out, right, I'd see these cases. It was something like 5 to 10 cases a week where someone, looked like they could be your average neighbor, was coming into the hospital for something critical, picture a heart attack, a stroke, and a lot of those cases struck a chord because it was often not the first heart attack or the first stroke. It was usually the second one. And one of the things about hospitalist medicine is you're really taught, in fact, the core of your specialty is the why, the core why, right? What we call the source problem. Is to go, okay, well, yeah, you're having chest pains. Yeah, you're having, it's 2 a.m. Yeah, you ran out of medicines, right? But then every time I got to the why of these 5 to 10 cases, it was a matter of life happened. I lost health insurance. I couldn't afford a doctor's fee. And so now I'm sitting in front of you, Dr. Jubril. It's 2 a.m. on a random Wednesday, and I just lost 15% of my ejection fraction, right? And these cases would just happen and happen again. And the straw that broke my back on it, I still remember it clearly. It was a 50-some-year-old school teacher. She could have been my aunt. And I'm talking to, I get the call from the ER. I fondly call her Alice now. So I get the call, Miss Alice is down here. She's having an NSTEMI, a heart attack essentially. She needs to be admitted, right? So I go in the room. It's late. It's dark. I'm getting a history from her. And as we dug in, well, why? Why did that happen? What happened? And there was a moment of silence where she essentially with a lot of shame. She revealed that she had lost health insurance and couldn't afford the $120 doctor's fee and couldn't afford to get the $4 medication she needed. And that's why she'd now suffered a second heart attack. And I was just like, whoa, like this is exactly it was so triggering for me because this was what happened some 20 years ago in Nigeria, right? That got me to go into medicine. And I'm going, there's no way, like right here, this is Nigeria here in South Jersey. And so that would be the drive to go into primary care. And the reason I smile saying that is because if you talk to a lot of my co-residents from residency, it's laughable that I'm now doing primary care for free because I hated primary care as a resident. So I'm just gonna pause there for a little bit there, but never looked back. And I think part of the why there for me, why it became such a driver to really the last 10 years now, I've done primary care, is that to be able to make healthcare possible for those of us who don't have the means to is everything.
Wow, such a moving story, and it's so interesting to really hear the parallels of what you experienced in Nigeria versus what you experienced right here in southern New Jersey. Well, not right here in southern New Jersey, quite a few miles south, but really, really inspiring stuff. And to your point, I know that primary care isn't often viewed as maybe the most exciting specialty, but it really is the one that stands to make the biggest impact on care and the care spectrum as a whole. You've talked a little bit about what drove you to primary care or what attracted you to primary care. Let's talk a little bit about the Cherry Hill Free Clinic. I think that it seems so apt that you've become involved with this group, especially considering your motivations. What does the role of a free clinic provide, and how does this really reflect, in your mind, the current state of healthcare and primary care specifically?
It's a great question. Your point earlier about primary care, to tell you more about why I hated primary care as a resident. So at the time, and it's interesting because it really tells the story of what's happened in healthcare as a whole in the U.S. So you're in residency, and the bulk of your medical education is in the hospital, right? And so you get really comfortable, resuscitating people, doing intubations, doing these cool procedures and whatnot, right? And the reason primary care was so boring to me was because, it was like, it felt like watching paint dry. It was like, you had to wait for if you ordered an ultrasound or a CAT scan, you had to wait weeks to get the results. In the hospital, you're getting a CAT scan like that. You're getting an MRI like that, right? And so for that reason, I was often a lot of times I was the resident who didn't really care I would trade anyone for my primary care clinics as a resident. And so it's funny that years later, right, realizing this need that, gosh, no, a lot of what we do within the hospital, it's reactionary at best. It's the damage done. It's Alice has lost 15% of her ejection fraction. It's the strokes happened with hemiplegia, and now you're just having to try to do what we often call secondary prevention, right? And so that realization that, gosh, primary care is really in a way where it begins, right? And more importantly, my journey to the founding of the Cherry Hill Free Clinic is being able to do that for those of us who again, life's just happened and you found yourself uninsured, and to still be able to do that, that's really what it's about.
Awesome. And now, thankfully for all of our listeners, this will probably be the last episodes that they see me interviewing you on. What can our listeners come to expect from this podcast in terms of what we'll be doing in the upcoming year and beyond?
Yeah, I'm really excited about this. This is we're going to talk all things primary care. So if you think through what happens in the doctor-patient relationship within the walls of the office, right? We're gonna really delve into that. But we're not gonna stop there. We're gonna go beyond the walls of the office, right? So, and specifically what I mean are things that shape healthcare as we know it, right? Things that shape healthcare both on the patient side when we talk social determinants of health and all of the other factors that really play a big role in health. We're going to talk that, and we're going to talk have some conversations about policy, about the things that really are upstream from what happens within the walls of the office. And so I'm really excited. So if you're a primary care doctor, if you're a specialist, if you're someone who's interested in healthcare and just want to get a sense for all of this through the lens of a primary care doc, you're in for a ride.
All right. Well, thank you for that insight. It is really refreshing, and I'm super excited to see all of the different faces we'll have on, from people talking about policy, leading decision makers in major organizations, and even some leading trialists that we'll have on throughout the year. But before we get to the guests and wrap this episode, I know you shared some really interesting backstory on yourself, how you came here, how you ended up being the host of the Primary Care Lens. Just to humanize you a little bit more for our audience, what's one interesting thing they should know about you when tuning in the future?
So I'll tell you this. My favorite mode of transportation is my bike. And for me, it's a combination of, so if I could have rode my bike yet, I would have done that. But yeah, every opportunity I get, I ride my bike, delivering Girl Scout cookies for my girls, or whether it's just, gonna go, and for me, it's a combination of, it's really practicing what I preach, all day in the office, which is that there's no medicine on anyone's shelf that could give you as much benefit as exercise, right? Eating healthy and exercising. And for me, that's it for me. It's that riding my bike.
All right, awesome.
And my I will share this too. A record miles in one day, 200 miles. I don't even like driving 200 miles. That's
crazy. Yeah. 200 miles in a day. No, wow. I never complain about my commute again. But just wanted to close. Thank you, Dr. Oyeyemi, for coming here, providing your perspective. Thank you to all of our listeners for joining us for the first episode of the Primary Care Lens. You can catch all future episodes on Patient Care Online, YouTube, Apple, Spotify, and all of your favorite podcast players. We'll see you next time.